Hi! Ever wondered what goes on behind the scenes of the health innovations we see? Or what health innovations are even out there in the first place? Well, welcome to African Digital Health Voices, your one-stop platform for all things digital health technology across Africa. From interviews with founders to pertinent conversations with stakeholders around tech-enabled healthcare, as well as updates on the latest in health tech, you are in for a good treat. Now sit back, relax, and enjoy the episode.
Hello everyone, and welcome back to another episode of the African Digital Health Voices, which is a podcast where we explore the trends, the tools, and the trailblazers shaping Africa's digital health future. I am your host, Vivian, and today's episode is very special. It's an Ask Me Anything series where we're going to drop all the formalities and really go into honest and insightful conversation with people who are behind the systems and strategies we all see and that we all celebrate. And for today's episode, I guess it's someone we are incredibly excited to speak with, who is very passionate about digital health and is a passionate leader from Rwanda's Ministry of Health and a key voice behind the newly launched Rwanda Health Intelligence Centre, which I believe is a transformative initiative to drive healthcare decisions at scale within the country. Sylvere is one of those rare leaders who gets both the policy side and the technical side of digital health, and is here today with us to really break down what this new center means, what gets him excited about the future, and why data might just be, Africa's next big public health superpower. Hello, Sylvere. Welcome to today's episode. If you can just say hello to our audience.
Thank you. Hello, thank you, Vivian. Thank you for hosting me.
Thank you so much for joining. So I want us to just start with, what have you been up to? This is like the second to the last week of May. If you could tell us, how your week has been. So we're recording this episode on a Friday. So if you could just run us through how your week has been so far.
Thank you, Vivian. And I'm very glad to be here and talking to the community. Yeah, the week is always busy as usual. Of course, I'm a person of kind of strategic, but also technical. So I have always a busy schedule where I need to make some meetings, where I need to also do some technical work of the business analysis and also the implement. The week was very busy. Let me start by maybe from the Monday ones. It was much of the senior management meeting. So I attended the senior management meeting where we get the direction and we report what we have been doing, and also gets also the excitement of our bosses telling us do this, do that. And then Tuesday was I worked on drafting the terms of reference. So as part of my job, so terms of reference requirements for software, it's also my work. So I drafted the software requirement for Rwanda Health Portal. So we are creating another mobile platform which is going to be helping anyone from his own angle where he's at home to be able to access his medical record and also to interact with hospitals. So that was my work for Tuesday and Wednesday. So I did it for 2 days. The draft was done, and then at the end, the next day was to draft the scope of work for support and maintenance of Rwanda Health Information Exchange. So this is a platform, interoperability platform that is already existing and working, but you need to enhance. We need some enhancement, and then I had to draft some scope of work for the enhancement. That was Wednesday, and then Thursday was a lot of meetings. I had different meetings. I can cite the meeting on the implementation to view the implementation of the electronic medical record that we are implementing in health centers. I wanted to see the progress. I had to go on field to see what's being implemented, what could be the challenges, how can you unlock, and all of that. Then this Friday, I had also a board meeting. So I'm now from a board meetings. I'm also a board member of what we call Muganga Sacco. This is a financial institution for all healthcare providers in country. So I'm part of the board, and I'm also chairing the ICT committee for that board. So that's how the week was. It was
Wow.
so busy, but it ends with this interview. Thank you.
Oh yeah, interesting. Wow, that's such a super packed schedule, and I don't know how you've been managing, but it seems like a lot. But then I think they are all impactful activities at each point in time. And as the adage says, on easy lies the head that wears the crown. So lots of people will say, "Oh, I'd like to be a senior analyst in the Ministry of Health." As you can hear now, this is all the many things you'll be doing if you are someone who is craving, those kind of roles. But I think they're really interesting, and if it's something you're passionate about, you get to just enjoy it as they come. So let's move in line with that, flow to really ask you, who is Sylvere? Beyond the job title, beyond your board meetings, drafting TORs, and scope, and every other thing that you do. What really pulled you into this space of, digital health or health informatics, and why is it personal for you?
The work I do is very interesting, and I like it because actually I've not been in any other work than technology. So after that, I did my first 3 years of senior secondary school. So I joined the digital transformation. And it was always technology until today. I enjoy the work I do. Why? Because I am not always in office. So I meet clients. And part of my job is to see if my clients who are the healthcare providers are satisfied. So which means I'm not that kind of technical guy who sits in the office and creates the product and does not know how it was perceived at the ground. So I have a chance to be in between. I have a chance to be at strategic level, but also technical, and also meeting the end users to see what are they, how are they perceiving what we give to them. So I like this way of working because it is a mixture. I can be like a user, technical, and also a strategist at both. So it makes you being in both worlds, and then you can feel the benefit of what you are doing, and you can feel the purpose, the transformation you are doing. If you see people using the tool, and the tool is facilitating them in their work, and the tool was designed, you were part of the design, you were part of the development, you feel like, oh, okay, you are rewarded in one way. So that's why I like this way of working. Another thing, when I'm not busy, I feel sick. So I'm like, oh, I'm not feeling well actually. So I'm good if I'm busy. So if I don't have, if I'm not doing anything, so I feel like I'm not good. I'm not doing well. So that's how who I am. So I always, even in my studies, I was doing like a bachelor, but having 3 workplaces. I was working in 3 workplaces and studying full time. So it was very challenging, but it has created in me a multitasking way of life. If I'm not busy, I feel like, oh, maybe I'm sick, I'm not feeling well. So that's me. Thank you.
Wow. Do you consider yourself a workaholic?
I'm missing something very, very important. I'm not having so much social life. So
yeah.
I've been missing this, and I'm also towards creating this because I've realized that if you ask me what did you do which is not related to your job, so it will be very small. It's a small percentage. So which means I'm missing some part of life. So I'm much concentrated on work. So that's why in my annual leaves, I've started creating these opportunities of not being close to what I do. I just go far away from what I do, and I make sure that people cannot drag me immediately to the work. So that's I'm starting creating travels when I'm on leave. So I travel so that people will not grab me immediately and then come back to work. So I've seen also this is very, very important for my brain to relax and also to get better.
That's really important, and I think it's really applaudable that you've been able to identify that gap, right? We can't all balance work, social life, so we have to really create time for both sides, right? That's great. So if you're on leave and you want to come to Nigeria anytime to relax, you can always let us know.
I'm
we
a
can
good
take
friend.
you around.
I'm a good
We're going to have a good time.
Yeah, sure.
And nobody
I have
can
good
drag
friends.
you. So.
I have people working in primary healthcare, I think, and we have met because they
You're already
need to
talking about
digitalize
work
primary
again.
healthcare. Sorry?
You're already talking about work again. We are saying you should come to Nigeria to come and relax. You're already talking about primary healthcare.
You see, that's me. So I'm always thinking about work. So I need to change that mind. That's a gap I've realized actually.
Yeah, definitely. Okay, so let's go into the Health Intelligence Centre in Rwanda that is making waves, and which is one of the main purpose why we are having this call today. So for those who have not heard about it, if you want to tell us exactly what the center is and what makes it really different from other efforts of countries around digital health that we've seen in Africa.
Thank you. I think I need to come back behind what you see, because actually what you see is a result of a lot of effort combined. So, and that's what it makes it special, because it is like an output of many efforts, initiatives that happened and still continuing happening. But what we managed to do is to put it together, all the efforts, and try to create an insight from different initiatives that is being done. Going back where it is coming from, actually, when you see the journey of the patient, it is always complex. I don't think it is only in our country, it's everywhere in different countries. Always all starts from home. You are feeling some symptoms, and then you feel not well, and then you go to the nearest point of care, and they capture data. Then when they cannot manage, they go to the next. You go to the next. You are referred to the next. And when you go to the next, they also ask you the same question. How do you feel? Okay, you repeat the symptoms, and then you go to the next. And sometimes a patient can go in this journey for 6 months, for 1 year, for 2 years, but they will be always asking him the same questions. Well, how do you feel? How do you, and sometimes the case has changed, and there's no way of knowing, capturing all of this data. So we have realized the gap in this journey, and that's why from 2020 we have created what we call healthcare digital transformation. This is it's something that was coming after that we have done some digitalization, but which were not much efficient and not much touching to the patient journey. So now we started that digital transformation with the aim to see how can we reduce the complexity of the patient journey. And then one of the projects that came out was to create a unique patient identifier, to create to make a patient unique across. So, and this one, to be able to create this unique patient across the all levels of care, all levels of care. So we needed to have like a centralized interoperability medium. So we needed to create an interoperability layer where all of these care levels can meet. So that's when we created what we call Rwanda Health Information Exchange. Rwanda Health Information Exchange, it's just it's a framework. It's a framework. It's a framework, which means it's a composition of multiple systems. Don't think like it is one system. No, it's made by different systems. But what it helps here, it's like a roundabout where all meets. So means you are coming from left, another is coming from right. You are coming from community, another one is treated from health post, another one is treated from the health center, another one is treated from private clinic, and then all the data meets to one patient who is identified at national level and having a unique identifier. So that was a number one project that we did, and that project created now the transformation in other systems that were existing. So if you have a clinic, for example, it is a private clinic, if the patient attended your clinic, you are required to request from the national level the unique identifier for this patient. And then you are given a unique identifier. And if you provide this unique identifier to this patient, it will be once for all. He will be using this identifier for all next steps. And then after treating this patient, after the episode, this patient at your clinic, you need to synchronize at the national level the important data. What do we call important data? So we have who was this client, who was this patient, what was his diagnosis, what was the prescription he did, what was the procedure if it happened, and what was also some allergies identified and some common information, medical information that you need to communicate to other levels. And then we take this information, we put them at the national level in the patient file. Then, if the patient goes to another clinic, now they can review, they can see the previous medical record. They can review the previous medical record. So we did this. So far, we have connected more than 5 systems. If I say 5 systems, it does not mean 5 facilities, because one system can be used by 500 facilities. Another system can be used by 100 facilities. So we have so far connected 5 systems, but our journey is to connect all the systems. Now, you understand how much huge data we are creating. You can imagine all the transaction that happens per day or per hour in the whole country, in all clinics, for all patients, in all systems. So you can imagine how much huge data we are creating. So now, this comes now, the national level, where we need to create that treatment of those huge data. And those huge data of the patient, they have all the information that you can use now for decision making. That's where the National Intelligence Centre came from. So the Intelligence Centre comes on the top of the interoperability layer, where now all the data from different systems, from different levels of care, are now putting together. And now the Intelligence Centre comes as an analytical business analysis system to help now to make the data use. So it means it can now create the sense of the data for the decision making. So the Intelligence Centre takes now all the data from the central interoperability layer, and now it creates now an analysis on the top of those data, and now it creates insights. Actually, the best of this Intelligence Centre, it combines now the medical record with other health records. It does not mean always that the medical record is only one that we use. We use also the other health indicators that are around, and then we put them together, and then the intelligence center analyzes those data, and now it can give you some insights. Let me give you an example. From the intelligence center, you can know how many patients has been, for example, saved their lives because the ambulance has arrived to them in the due time. For example, we count like 15 minutes for if you have called for an ambulance, so you should be having that emergency response immediately in 15 minutes. So you can imagine we can combine the data from the ambulance traveling plus the maternal child death plus. So this intelligence center, what is bringing us unique, it's combining a different type of health data, and now it creates some insights that can now tell you something. Like today, you can know where to invest and create a new health facility, for example. It can tell you, you know what, because of the population that is in this area, so and because of the number of health facility that is in this area, if I can calculate the distance between the facilities, so you need to place the facility in this kilometers. So those kind of data, you can see them in the intelligence center. So that's now which makes it unique. It's like we have a huge data. It is now based on the individual data. It can now calculate and add different health indicators, health data, and then it gives you now some new insight that you could not think about.
Wow, this is such an incredible work that Rwanda has really undertaken. And I'm seeing that it's not just what we are seeing on the internet today. This has been something that has been in the work, for some years now, and you're just kind of building on top of, the digitization that has been done, the interoperability that has been done, then synchronizing all of these into the health center. So, in terms of the data, that are coming from these 5 systems, are they standardized? Because I think for you to be able to use them, they probably have to be in like maybe the same format, or they're collected in maybe similar ways. So how does that work?
Very good question. Actually, you cannot harmonize, cannot standardize without having standards, of course. So we did not create standards. Rwanda did not create any standards. So we adopted the international standards. So we have taken different standards that is around the world and said, okay, so we need to create the way that systems in a country can talk to each other. So what do we do? We know these systems has not been developed by same developers. It has not been conceived the same way. So how do we do? What do we do? So at the national level, we have adopted standards. So we said, okay, for any patient file, you need to identify a patient using this standard. So the patient should be identified using HR7 file. That's an example, and that's the standard we use. And whenever you need to exchange the data of a patient, so you need always to use HR7 file. That's an example of a standard that we adopted. Yeah. So we have also adopted image standards. We use DICOM. We have also adopted how do you write diagnosis. For the whole country, you need to write diagnosis in ICD level. So that's the standard. So for example, for exchanging the laboratory exam. So if you are writing the laboratory exam, how do you write? So you need to use the Royin. So those are the standards. So we have a book, we have like the whole standard that we adopted, and we ask whoever needs to interact in this ecosystem to use same standards. And the ministry has offered the letter to whole country that whenever you are creating any digital solution for health, so please make sure that you are using this kind of standards. So for the procedures, we use the INCHE. You have to write the medical procedures using INCHE. Those are examples. So any country can choose any standard depending on, for us, the basis was the standard that are adopted by WHO, the standard accepted by WHO. So those, and also the open ones. We chose standards according to the open.
Yeah, that's really interesting. I think other countries, other implementers can really learn from this experience. So in terms of stakeholders that were involved to make this a reality or to make this work or to make this a success, what did that look like in terms of stakeholder engagement? Who were the people involved in making all of this?
Very interesting. That's very interesting. Actually, let me clarify that this is not something the government can do alone. It's not possible. So you need stakeholders. And you need stakeholders from different levels. You need stakeholders from the user perspective, healthcare providers. You need hospitals. But you need also stakeholders who understands your vision and who need to support you to achieve this vision. So, and you need also private sector. This is very important. I need to mention this. For us, we agree that the government does not develop. So the government is there to set standards. The government is there to set the requirements. So we need to set what we need, and then we give it to the private sector, and the private sector, they need to develop. And we pay them. At the end of the day, we are building our economy. And the best way of Rwanda is like we are building our local capacities. So even if we can acquire any expertise from outside, but most of more than 80% of the team that you are working with should be local staff. So that we can remain in country those capacities, because we have seen some lessons from COVID time where we tried to use the external systems and we could not get support because it was not easy to travel and all of that. So in that case, we have started building our internal capacities. So number one, stakeholders are involved. Private sector is very much involved. They are the one developing. We give them the requirement. So they give us the product. We test and we own the products. So, and then at the end, we have also stakeholders who are non-government organization that supports in terms of finance. Of course, the owner pocket of the government could not support all of this. So we needed also to have some different funders from different angles. So we had different funders for this. So it's an activity that was funded from different stakeholders. And most of the big part of the funds is coming from external vendors, external stakeholders. The government is much on infrastructure, guidelines, policies, and standards. So we are happy that our stakeholders are also supporting and they understand our vision and they can create such a great initiative and support it and come and make it live.
So yes, we had some questions on LinkedIn, just to also get questions from the public, those who are interested in understanding this intelligence center. So we have some questions here, which I'll just quickly read out. I'll read those who are like similar together so you can take them together. So in terms of data use, we have questions around data protection. How do you plan to handle patients' data protection? How can your data be used in cases of public health emergencies? I know you already mentioned that at the beginning. If you could touch on that a bit. Then what other data questions do we have here? Yes, how does the private sector access this data? So these are the questions related to data, if you could take them together.
Thank you. In terms of data protection, of course, we totally understand the privacy of individuals is very, very important. And in Rwanda, we have already a set of standards and strategies, and the ground is already regulated. So we have a data protection law that guides everything. So means whatever we are building, it's according to the data privacy and protection law. So we have it. And in terms of the data that you are seeing at the screen in the National Intelligence Centre, they are the aggregate data, they are the outputs. There is no names that you can see, so we protect the personal identifiable information. So you cannot see, you can see 10 people has been identified as malaria cases, but you can't know that what was the names of these people. Of course, behind the scene in the databases, we have some names, but in terms of just public view, so we protect personal identifiable information. So in terms of data at rest, so we have also some encryption algorithm. So you can't just fall into the database and immediately read and be able to know the data, they identify the individual data. So they are also encrypted at rest. And in the transit, data from system to the national and from systems to the National Intelligence Centre, the transportation is also encrypted. So how can people use this data? So far, until you visit the National Intelligence Centre, you will not be able to see this data. So we have not yet defined how do we make this data public. We are developing through the Ministry of ICT, we are developing the guidelines, which is called Open Data Guidelines. So which is it's an open data policy. This open data policy is going to be able to say, okay, this type of data, this classified data, this data of this nature is allowed to be open. And then we will have a portal where we put the open data so that anyone who needs this data can now access them. But until now, it's not public. So of course you can come and visit. And if you need some data upon the request, so we have data protection officers, so who are also nominated, so who can now receive your request and give you type of data that you need. The data of personal data is well protected, and you can get them on request, but we are also proceeding to the level where we need to make some data public, unless now there is a signed report. Of course, we have Rwanda Biomedical Centre, which is an affiliated institution to the Ministry of Health. We publish some annually and also some quarterly reports. From there, you can get some data to use for open, but we are also towards the way to define and be able to have some open data soon. So we are starting from nothing. We are now on one, but we are also towards the good way of like sharing this data, because we know it contributes on the research and it helps also for improving and doing some innovations. Okay.
Interesting. Thank you so much, because I think it's really important for us to find a way to make this data make sense for people on the ground. People who are researching for public health emergencies and stuff. So moving from still on data, now let's talk about AI, right? Seeing that this center sits on a large data set, and not just large, it's very diverse, right? So where does AI come in? Is the ministry thinking about integrating AI, and what difference do you see that it can make?
Okay, I think people need to understand that the National Intelligence Centre, it is already an AI. So it's to get those insights and to get those data. So we are taking the huge data you're talking about that we have put together. We put them in the AI, and it is the AI producing the output that you see on the screen. So we are already using the AI. So it's the transformation, that the analysis we are doing, it's already through the AI. So we are passing the huge data to the AI, and the AI is now processing and tell you what, in the next 2 years you are risking to have maternal mortality, which is high. So that's the kind of the insight that you can get from the intelligence center. So we have already injected the AI, and we are using the AI because we have data. I know people used to talk about the AI, but the AI does not exist without data. So the AI, the food of AI, the fuel of the AI is data. So you need first to have data. We know people may think, yeah, you can go there and create the AI, but the AI will not be as good as you need it if you don't train them. You don't train it with huge data, with diversity of data. So you need to have that kind of a huge data putting together. That's why, for us, the foundation of having all of these levels of care digitalized and capturing all this diversity data, for us it makes us now to have the basic of using AI. We can now benefit from the AI. That's how it works. So, and our National Intelligence Center is based on the AI.
Interesting. We're not in the future. Great work you're doing in Rwanda. So let's look at sustainability. I know you mentioned funding from external partners and stuff, and looking at the funding, how would I call it, withdrawal of funding from donors in the recent months. How is the ministry thinking of sustainability beyond this initial maybe launch, and maybe you have like a, how would I call it, 5-year plan or 10 years plan in terms of sustainability?
Yeah, thank you. In this intelligence center, actually, we did not do only infrastructure. We have also created human resource around it. So if you have chance to visit, so you will see the team. So we have already the team and the local team. So even if we are using the stakeholders funding, so to create this initial stage, but we are also creating the expertise around it. So we have created already a team. So we have a team of developers, we have a team of doctors, we have a team of data analysts, we have the team of all technical expertise that we need to maintain this intelligence center. So that gives us a chance to say, okay, of course, we know people can also leave, but as long as it's a local capacity, we know that we are building one thing in the sustainability. And technically, we have also planned for a knowledge transfer. Of course, we have worked with different stakeholders who are having external expertise and who may be returning back to their homes. But we are much at 80% for now. We control our intelligence center, which means the 20% that is remaining is just a knowledge transfer that is being done. We hope that actually that's our principle as a country. Whatever digital solution that we create, we have to own it 100%. That's what we do, and it's in a good move. Actually, it has started this Feb, and we think if we are at 80% owning it now, I think by the end of this year we will be having all the 100% having full capacity of running this intelligence center without any external participant.
Incredible. That's such a great plan in place, right? So if you could share maybe certain lessons with countries who are interested in also doing something similar, or interested in also advancing their digital health strategies or digitization or any transformation they really want to do around digital health, not just countries now, even implementers, developers, innovators. What are some key lessons you've learned from this journey, starting all the way from, I think you said 2020, right? If I'm correct, where you started this journey. So what key lessons would you want to give people who are interested in this similar progress?
Thank you. Number one, a key lesson is like you need to have a vision, and you need to have a unified vision. You need to have one vision. Actually, I know many countries have very good documents, very good vision in terms of documents and strategies. But what is being done on ground is something different. And you need to have one same vision, government plus stakeholders. I need to emphasize on this because sometimes I'm a stakeholder and I'm interested in supporting TB. And I'm only supporting TB and I'm digitalizing TB program. Or I'm interested in malaria, or I'm interested in HIV, or I'm interested in vaccination. I don't care about any other thing. So this vertical digitalization of programs, it will not let you end with good results. That's what we actually changed. So we started by changing this of like, no, we stop all digitalization of programs. Now let's do a comprehensive digital systems where the system or where the digital solution provides a solution for more than one program, and then focus on patient. Because at the end of the day, the patient who is suffering from malaria can be the same patient with HIV and can be the same patient with TB. But you are managing them separately. It's like you are having 4 or 5 patients in one. So in that case, the analysis will be hard because they will be already having not a real number of your patients. You can't count the patients. You can't also follow. You can't follow the journey of the patient. The patient are suffering. You are also suffering in terms of data, and you cannot take decisions. Let's first have a unified digitalization vision, which makes comprehensive digital tools, where you can have one tool solving multiple problems and taking care, be patient-centered. Don't just be like you need to collect data for your own. You see the patient. What are the benefits of the patient? That's number one. Number two, interoperability. Very, very important. Interoperability goes with the standards. Of course, you will never have one system in the whole country. You will always have multiple systems. That does not matter. There's no problem with that. You can have 1,000 systems in one country. But is those systems able to talk to each other? Is those systems able to exchange them? If you have not set standards, if you have not set rules and standards that harmonizes the exchange of the data between all of these systems and between all of these healthcare levels, so it will not be easy for you to have a digitalization, to have a huge data that we are creating for AI. So number three, it's governance. Normally, governance and leadership comes on top. Because all of this, it is not technical. To tell you the truth, we are succeeding not because we have the good experts. We are succeeding because of leadership. We are succeeding because of governance. So if the top leadership from the top of the country, if they are not supporting this kind of initiative, because they are very huge. It's a huge investment. You can't imagine, it's billions of dollars. So, and I don't think the technical leader can take a decision to expand, to spend this $1 billion on this kind of infrastructure. So, the top leadership, the top governance has to be in. They have to buy in this digitalization journey. If you have the top governance, the top leadership, like supporting you, so anything technical is possible. You can do anything technically, everything you can do, it's possible. So these three main things, and you should also have something like an architecture. So when you are building without an architecture, so you are building for destroying. Actually, you will not gain. You will always be. Today you have an idea, but tomorrow you change it. So you should also have a clear architecture of what you are trying to build. And then you start building while you have an architecture showing this is block A, block B will work with block C, and who is responsible for this and who is responsible for that. So these 4 points, if you can create, you can have them in your own country. So you will get now to the intelligence center because you will create a harmonized, standardized way of exchanging data. You can now make a patient unique, and then you can now have the huge data you create. Now you put the AI on the top, and now you get to intelligence center.
Wow. This is such a masterclass. Thank you so much, because a lot of time what we see is people are hyped about AI. They start from the AI. They forget that, they are building blocks. Yes, they are building blocks to put in place before you get to the AI components. Thank you so much, Sylvia. This has been an interesting conversation. It's really eye-opening to see the steps that we're taking to get to, the Health Intelligence Centre that we have now in Rwanda. So just to wrap up, I have a little rapid fire round for you, where you will just say the first thing that comes to your mind. So let's say coffee or tea.
Coffee.
Wow, interesting. Coffee. Well, you need it. You work a lot, so.
Yeah, that's very important.
Yeah. So what's your most used app on your phone?
I think it's WhatsApp.
WhatsApp.
Yeah.
Obviously. Okay. Yes. So what is a dream health tech innovation you wish existed?
Actually, the interoperability.
Okay. But it's already existing. I think it's now existing in Rwanda, right? So
it exists, but I wish it could exist to the whole world, because at the end of the day we move. And,
Exactly. Okay, so one country you think is doing something really cool in digital health outside of Rwanda?
I think Estonia.
Yeah, that's true.
I very much appreciate the X-Road initiative. Very much appreciative.
That's cool. So thank you so much for joining us today. I think the insights, your journey, your work at the Rwanda Health Intelligence Centre, and even the Ministry of Health as a whole, has been truly inspiring, and we're excited to see how Rwanda continues to lead on the continent in building a smarter, more equitable health systems, using data right in Africa. So to our listeners, thank you so much for tuning in. Don't forget to subscribe and share this episode, and follow us at African Digital Voices for more stories that are shaping the future of health in Africa. Until next time, stay connected, and let's keep raising our voice for better health in Africa. Thank you.